Hi everyone, this is Dr. Heather Austin Robillard, and this lecture video is going to go over the different theories of addiction. Why do individuals use substances or engage in behaviors that have a tendency to become addictive? This lecture will focus on answering those questions by discussing several popular theories of addiction. For this module, you should have already read the chapter on the etiology of substance abuse. Why people use. However, primarily we will be focusing on several models of addiction that aren't covered in your book chapter. This might include the academic model, the diathesis stress model, and the process model of addiction. As you've read so far, there are multiple models of addiction that exist. These models have been created to provide an explanation for why individuals use substances and where their addictions have originated from. The different models have an impact on the way professionals treat and work with individuals with an addictive disorder. Etiology explains both the why and where. Why an individual becomes addicted to drinking, drugs, or a certain addictive behavior, and where the individual's addiction has originated from. Before moving to the next slide, I want you to consider whether or not you believe there is a right or a wrong theory of addiction. What would you base this answer on? Because the chapter that you read for this module does a pretty good job of going over most of the theories of addiction, this lecture PowerPoint will touch on some of those theories that were also talked about in the book, but it will mainly focus on a few models that have implications for treatment, something not necessarily discussed in the textbook. One theory of addiction that creates a lot of controversy and debate is the moral model. This model is one of the oldest theories of why people become addicted, and a common reaction towards addiction for those who may not have been educated about the originations and the research about addiction. And even if they have been educated, oftentimes certain family members of a loved one with an addiction still are stigmatized to think of it through the moral model lens. This model assumes that addiction is based on a weakness or the moral character of that individual. They're not strong enough, or they don't have they don't have a strong enough willpower. That person is just too weak to say no. The model emphasizes personal choice, willpower. It's often the stance that the criminal justice system takes. That you have broken the law, and now you will be punished by that law because you did not have the willpower to just say no. What these assumptions then lead people to believe is that an addict is held responsible for their inability to quit. That in order to move into recovery, the individual only needs to decide that they want to quit. This viewpoint is commonly taken towards sexual offenders and mental illness. Think about the example of telling someone who is depressed that they just need to snap out of it, or they need to get up and get ready for their day. This will help you feel better. For those of you who have taken several addiction courses, this model might seem silly for you or inappropriate, and you probably think, why is this model even acknowledged today? What is important is that we can use this model to normalize family members' initial reactions to their addicted loved one by educating them that this model and where it came from. Professionals today still use some aspects of this model in treatment. They might use it in the terms of helping individuals to understand the power of personal choice. Not that addiction is as easy as making better choices, but that choice is part of the treatment process and the importance of addressing spirituality during treatment. Now let's look at the academic model. This model is founded on the assumption that addiction is caused by the body's adaptation to continued use of addictive behaviors or substances, which is seen at the biochemical and cellular level. The model states that given enough of the substance or time engaging in that behavior, an individual will become addicted eventually. The body adapts to these toxic effects of the drugs at a biochemical and cellular level in the process called allostasis. The drug disrupts the homeostasis of the body, particularly the brain chemistry. If a person is given sufficient amount of drugs for enough time, their body and brain will change as an adaptive mechanism. If the attempt to rebalance the brain leads to long-term changes, that will reinforce the addiction. This model states that you will see specific physiological changes such as tolerance, tissue dependence, withdrawal syndrome, and physical dependence. If we look at tolerance, tolerance results in the body's attempt to eliminate that drug that it treats as a toxin with the continued use of the substance of behavior that the body tries to neutralize the toxic effects by requiring larger amounts of that drug to achieve the original effects. The degree of this effect depends on several factors: the amount used, the duration that it's used, how frequently it's used, an individual's just brain chemistry, and their state of mind. Tissue dependence is the next stage in this model after tolerance. This is the biological adaptation of the body to the drug or behavior such that the body becomes dependent on the substance or behavior to stay in balance or to maintain homeostasis. The tissue and the organs of the body become to depend on that drug to stay functional. A good example of this would be an alcoholic who needs to drink in order to prevent their body from shaking. Or a heroin addict who needs to use in order to prevent headaches from occurring. This leads into withdrawal. Withdrawal is an aspect of the academic model. This is the unpleasant effects that follow the cessation or the stopping of the drug. The body attempts to restore its chemical balance. Some withdrawal symptoms can be so severe that the user will continue to use drugs to avoid the painful symptoms, even if they do not want the drug. Withdrawal symptoms can also be dangerous to one's health. Depending on the substance of abuse, an individual may need medical monitoring while their body is restoring itself, like alcohol, which is one of the most dangerous drugs to withdraw from because your body can go into convulsions and seizures. Withdrawal symptoms can also include emotional impacts, sweating, headaches, vomiting, diarrhea, tremors, flashbacks. Then we move on to psychological dependence. This is the final aspect of the academic model. This is the result of the drug impacting the brain chemistry and the individual feeling that they need that in order to continue use for emotional stability. The pleasurable effects of their use reinforces the desire to continue to use. This is recognized as an important motivating factor in developing an addiction. Be thinking about, how is this model different from the disease model, or how is it similar? We will talk more about the disease model in the future. Another model that wasn't talked about in your textbook is the diathesis stress model. This model assumes that the person will develop an addictive disorder due to both a biological predisposition and that they are impacted by certain environmental factors. It's kind of the nature and nurture. The person who is predisposed will have a genetic and environmental factors that are combined with both the availability of the drug and the practice of certain behaviors. Genetic influence varies depend on different factors such as the substance of abuse. Environmental risk factors include physical, sexual, emotional abuse, stress, nutrition, living conditions, family relationships, healthcare, school quality, socioeconomic status, and many more. These predispositions are aggravated or triggered due to the stress and substance use or engaging in compulsive behaviors. When the individual becomes stressed, the brain changes to the point where ceasing use may be very difficult. In other words, an addiction has developed. So as you can see from this chart, the red part is kind of that continuum of use that you've seen in earlier classes. And the blue and the green parts are both contributing to that cycle. So there's the social factors, peer pressure, positive expectations, drug use, all of that. And then learning factors. So there are pleasurable effects of the drugs are reinforcing that behavior. And then there's the genetic factors or the sociocultural factors, which we'll talk about a little bit more, that all contribute to the individual going down this continuum of addiction. And we're just going to briefly touch on the behavioral theories, which were talked about a little bit more in your book. There is the social learning theory, which is the assumptions are that changes happen through the rewards gained by the use. This theory very much emphasizes that it's all about the specific behavior, that learned behavior. It's maintained by a habit and positive reinforcement. So the positive reinforcement would be the drug's pleasurable effects on the brain. Use happens based on that reward, which the reward is the pleasurable feeling, and it forms the use pattern. Recovery through the social learning theory would be that change happens by by introducing a new or changing the reward stimulus. So another part that we kind of saw in the diathesis stress model is the sociocultural theory, which this is somewhat similar to the learning theory in that these learned behaviors are from environmental factors. Specific environmental factors like gender, race, socioeconomic status, they all provide an environment that increase the likelihood or chance for use and continue to maintain that homeostasis of use within the system. So in this theory, the main assumption for change is that there needs to be change in the broader system in order to give the individual the best chance for change. We often see this also in family therapy for addiction, that we believe, yes, the individual needs to change, but within the larger system within the family also needs to change. Otherwise, you're putting them back into a system that's all trying to change them back, even though it's a good change. So the sociocultural theory is that we need to change some of these broader systems that influence addiction in order to give the individual the best chance for recovery. Okay, this next model, the process model of addiction, you may have learned about in other classes, but it wasn't talked about in the textbook, and it's an important theory of addiction that helps treatment models. The process model of addiction and recovery was created by Dr. Kitty Harris in 1995, and she's actually from Texas Tech, and focuses on the systemic and developmental nature of recovery. The primary assumption of this model is that everyone experiences pain in their life, and that pain causes discomfort or turmoil. An individual might choose how to react to the pain either through a cycle of compulsive behaviors or through a cycle of coping behaviors. The process model of addiction and recovery then assumes that if an individual does not have enough protective factors when pain is present in the system, then the individual will engage in the compulsive cycle of behaviors, and substance abuse dependence will likely occur. The model is based on how individuals cope and the use of protective factors to build resiliency. Another important assumption of this model is that the longer the individual spends in the cycle, the harder it is for them to break out of it. For example, the longer that one stays in the compulsive cycle, negative coping, the more difficult it will be for someone to move into the process of recovery where they utilize positive coping mechanisms. The first aspect of this model is pain, be it physical pain like headaches, injuries, chronic pain, or mental pain like depression, anxiety, and attention deficit disorder. It can even be emotional pain, rejection, disappointment, anger, abandonment. Then there's social. They feel lonely, they're isolated. There's even a lot of spiritual pain, a lack of purpose, emptiness, hopelessness. We can look at this pain as a trigger or a start of the model. To manage the discomfort of any one of those types of pain, an individual might try to reduce their discomfort through the use of substances or some other kind of compulsive behavior. If the individual repeatedly turns to this addictive substance or behavior, this can also turn into compulsive use or an addictive disorder. In early stages of substance use, an individual may report feeling normal for the first time in their lives. The feeling of normality will initially bring some relief to the individual in terms of their discomfort from pain. The The fourth stage in the compulsive cycle is the negative consequences. After a repeated use of the substance or repeated use of the behavior to cope, this can turn into an addiction, and that's when the individual will begin to experience a number of negative consequences associated with this compulsive behavior. These consequences are typically related to 5 different categories. It might be related to their health, such as feeling ill, actually having damage to their liver, a decreased brain functioning. It can be due to their relationships, a lot of discord in their relationship with their parents, spouses, friends, siblings. It can impact their employment or school, such as a loss of job or dropping out of school. It can impact them financially, bankruptcy or debt. And then there's also legal, such as driving while intoxicated, citations, prison time. It is important to recognize that not all people will experience such severe consequences to their behavior without them actually still being addicted to it. However, individuals are likely to experience at least one negative consequence of their use. The fifth stage of the cycle is guilt and shame. An individual will feel guilty about what they've done and shame around who they are. According to this model, an individual will likely feel guilt and shame due to the negative consequences, which leads to more pain, and then the repetition of the cycle begins all over again. It is due to this recursive nature of the cycle that one can understand how difficult it can be for an individual to break out of this cycle and move into a coping cycle. The compulsive cycle of the process model will continue to repeat itself until the cycle is broken. How do we break out of the compulsive cycle? Treatment professionals often work with individuals to help them learn new ways to cope with that pain and to help prevent the compulsive behavior from being the only way that they know how to cope. They can help the individual identify triggers, barriers of using, positive coping behaviors, and provide them with professional care to deal with the addictive disorders. The community or society often intervenes at the negative consequences. An individual who's received a citation for driving may have to attend a group treatment for addiction. The result of the ticket may be enough to motivate the individual to seek help or learn new coping mechanisms on their own. Family and friends typically step in and intervene at the guilt and shame stage. When a loved one understands their addictive disorder and can move beyond the moral model, they learn how to interact with the individual living with an addiction in a non-shaming way, which this can help reduce the person's pain and help stop that cycle from being repeated. Once the individual has stepped out of the compulsive cycle and started the process of learning how to be resilient in the face of pain, they will move into the coping cycle. This does not mean that an individual will no longer feel pain. It means that an individual will build new protective factors that help prevent them from utilizing those negative compulsive behaviors they previously used. Individuals will practice healthy coping mechanisms to deal with their pain. Some of the coping mechanisms that are identified as being the most beneficial for recovery are anger management skills, communication skills, problem solving, decision-making skills, education, relationship skills, and financial literacy. As the individual continues to have success in using new coping behaviors and refraining from their old compulsive behaviors, the individual begins to build self-esteem. They report feeling better about themselves, being confident and satisfied with who they are, and a more positive view of the worth that they are as a person. The increase in their confidence and self-esteem ultimately leads to positive consequences for the changes that they are making in their life. The same 5 categories of the compulsive cycle apply here as well: health, relationships, employment, school, financial, legal. Individuals may have more energy to put into their work or school. They begin the process of repairing their relationships. Their health begins to improve, and they can work more responsibly on their finances. As the individual moves through the coping cycle, they learn new coping techniques, increase their self-esteem, receive positive reinforcements, And taken together, these experiences work to rebuild resiliency, or the ability to recover from strain or negative situations. The more and more that they are able to be faced with pain and use the positive coping technique, the greater accumulation of resiliency they will have. The more supportive their environment or family system, the more likely they will be able to remain in the coping cycle. The process model of addiction and recovery put together. The far left and the far right side indicate the compulsive cycle and the coping cycle. The middle section identifies the commonalities, the painful experiences, the selective behavior, how an individual responds, the outcome of the selective behavior, either positive or negative, and finally, the end result, either feeling guilt and shame or feeling resilient. This model identifies the recursive nature of how one selects to respond to pain, how difficult it can be to get out of the cycle. The model stresses the importance of support systems. Finally, the model identifies important stages of intervention for the family, professionals, and the community. This model can serve as a helpful tool for working with families to explain the process of addiction and our goal in treatment.